Today on the show, we're diving into the world of economic indicators. These are the numbers that tell us how the economy is doing, things like GDP, unemployment rates, and consumer confidence. But what do these indicators really mean? How are they calculated? And how should we interpret them? We'll break it all down for you, with the help of some experts, to make sense of the numbers that shape our world. If you're a man over 60, I want to ask you a question that may feel too private to say out loud, but too important to ignore. Have you ever noticed that something about your sex life just doesn't feel the same anymore? But you don't know why? You're not alone, and you're not broken. As a urologist with over 30 years of experience, I've sat across from thousands of men who felt frustrated, tired, ashamed, or simply confused about what's happening in their bodies. Their complaints often begin subtly: less energy, weaker erections, a sense that intimacy no longer feels satisfying. At first glance, these men appear healthy. Many still exercise, eat well, and stay mentally sharp. But behind closed doors, they're unknowingly making small, silent mistakes, habits that made sense when they were 30 or 40, but now sabotage their health without warning signs until it's too late. And one of the most overlooked areas, masturbation. Yes, that very private act so often labeled as harmless or even therapeutic, can slowly wear down your body after 60 if done the wrong way. In this guide, I'll walk you through the 4 most dangerous masturbation mistakes older men make, and more importantly, how to stop them before they damage your prostate, your erections, and your peace of mind. If this topic hits close to home, or you simply want to protect your energy, intimacy, and vitality as you age, I invite you to subscribe to our channel and stay connected. You deserve the truth, not taboos. Now, begin. Mistake number 1. Forcing erections and rushing to climax when urgency becomes the enemy of vitality. One of the most common and damaging habits I see among older men is this: they try to pleasure themselves the same way they did at 30. Fast, forceful, goal-driven. But what they don't realize is that their body, the very instrument of their sexuality, has changed. And when you ignore those changes, you don't just lose pleasure, you risk injuring yourself in ways that quietly steal your strength over time. Let me explain. In your 60s and beyond, the body begins to shift. Blood flow decreases, especially to the smaller vessels that support erectile tissue. Nerve sensitivity becomes more subtle, less urgent. Testosterone production slows, and with it, the whole cascade of sexual response from desire to climax takes on a different rhythm. Not broken, just different. Yet most men never receive this message. When arousal feels slow, or erections don't arrive on command, they panic. They grip harder, they move faster, they push their bodies as if they can force their way back to what once came naturally. But this kind of pressure, physical and psychological, is not just ineffective, it's dangerous. Here's why. 1. Microtrauma to penile tissue. Forcing an erection when blood flow is limited can lead to tiny, invisible tears in the erectile tissue. These don't hurt right away, but over time, they scar. And scar tissue doesn't stretch like healthy tissue, which can lead to reduced firmness or even Peyronie's disease, a condition where curved, painful erections form due to internal scarring. 2. Strain on the prostate and pelvic floor. Older men often apply pressure near the base of the penis or on the perineum to stimulate release. But the prostate, already more fragile with age, doesn't tolerate this well. Chronic pressure and strain can lead to inflammation, known as prostatitis, or contribute to urinary issues like urgency, incomplete emptying, and nocturia. Frequent nighttime urination. 3. Nerve desensitization and emotional stress. When climax doesn't come quickly, men often enter a cycle of mental frustration. Why isn't this working? This emotional stress sends cortisol through the bloodstream, which further inhibits blood flow and testosterone and dampens the very arousal they're chasing. The result is a loop of performance anxiety that only reinforces dysfunction. But perhaps most dangerous of all is that this damage doesn't show up right away. There are no bruises, no sharp pains, just a slow erosion of sensation, confidence, and connection. You may start to notice You're less aroused by touch. That climax feels dull. That your erections are weak, less frequent. Or that you're just going through the motions. So how do you reverse this? It begins with one powerful shift. Stop forcing. Start listening. I coach my patients to adopt a different mindset, one rooted in curiosity, not conquest. Think of arousal as a process to explore, not a result to achieve. Use slower, gentler strokes. Experiment with changes in touch, temperature, breath. Allow arousal to build without pressure. Some men find more sensation from simply holding their body in new ways or focusing on breathing and presence instead of speed and friction. And above all, don't shame yourself. You're not failing. You're evolving. And the way you relate to your body must evolve too. Masturbation after 60 can still be deeply satisfying, but only if you treat your body as an ally, not a machine to be fixed or forced. Now that we've explored how forcing can do more harm than good, let's move on to the second mistake, one that doesn't just affect your body, but reshapes your brain's ability to feel real intimacy. Mistake number 2. Relying on pornography as the only stimulus, rewiring your brain away from real intimacy. Me share a quiet moment I'll never forget. He was 67, sharp, articulate, and successful in every outward way. But as he sat across from me in the exam room, he looked lost. Not physically, but emotionally. I asked a gentle question about his sexual habits, and after a long pause, he said, "Doctor, I don't feel anything anymore unless I'm watching something online." Then he added, with embarrassment in his voice, "And even then, it's not the same. This is more common than you think." I've heard similar confessions from dozens of men over the years, men who gradually lost interest in physical connection with their partners or found themselves numb to the simple pleasure of touch. At first, they think it's low testosterone, or aging, or stress, but often, the real culprit is something more subtle: over-reliance on pornography. Now, let me be clear, this isn't a moral judgment. I'm not here to shame anyone for their choices. My concern, as your doctor, is about how the brain responds biologically to constant artificial stimulation, especially in your 60s and beyond. When you rely on high-speed, high-intensity porn as your only form of arousal, you're doing more than just watching videos. You're training your brain to expect an unnatural level of stimulation. It's like blasting your reward system with a fire hose of dopamine day after day. And over time, something shifts. 1. Desensitization of the reward system. The brain adapts to overstimulation by becoming less responsive. That means the content that once excited you now barely registers. So you seek more extreme material, longer sessions, or more frequent exposure just to feel something. This creates a feedback loop. The more you use, the less satisfied you feel. And the less satisfied you feel, the more you chase the next hit. It's not unlike how the body builds tolerance to a drug. Only in this case, it's pleasure, intimacy, and connection that suffer. 2. Disconnection from real-world intimacy. Many men find themselves no longer aroused by real-life partners. The sight, scent, or sound of a loved one doesn't trigger the same response as curated digital content. Your nervous system becomes so conditioned to pixels and performance that human touch feels flat by comparison. The result? Emotional distance, avoidance, sometimes even sadness or depression. I've had patients in tears, wondering why they feel empty in moments that used to bring warmth. They miss what they once had, but don't realize how their own habits helped erode it. 3. Loss of erotic imagination. Remember when you could fantasize without needing anything on a screen? That capacity, the mind's natural erotic energy, can fade when outsourced too often to porn. The inner world shrinks, creativity dulls, even daydreams lose their spark. But here's the good news: the brain can change. Even after 60, your neural pathways are not set in stone. You can retrain your brain to respond to reality again. Start small. Begin by reducing your dependence on digital content. Maybe skip the screen once a week. Use memory, fantasy, or even literature to stimulate the imagination. Reawaken your internal world. You might feel frustrated at first, That's normal. But with time, touch becomes meaningful again. Sensation returns. Desire becomes rooted not in spectacle, but in presence. This isn't about giving something up. It's about getting something back. Your natural arousal, your sense of connection, your joy. So if you've been feeling more distant, more numb, know this. It's not a failure of age or character. It's simply a call to come home to yourself and to what's real. In the next section, we'll talk about a habit that drains your energy, clouds your mood, and steals your vitality slowly, yet so subtly that most men never see it coming. 3. Masturbating too frequently for your energy levels? When a soothing habit turns into silent depletion. Sat in my office, hands folded, eyes tired. He was 71, retired, still active in many ways, walking, gardening, even volunteering at his local church. But lately, something had shifted. He was always exhausted. His motivation had disappeared. And he asked me something most men hesitate to bring up. Doctor, is it possible I'm doing it too often? Yes, it's more than possible. It's common. Now let me be clear. Masturbation in itself is not harmful. In fact, some level of sexual expression is healthy at any age. It can release tension, boost mood, and even improve sleep. But just like with food, exercise, or anything else, too much of a good thing at the wrong time becomes a burden. Especially after 60.1. Your recovery system is slower now in your 30s. In 40 seconds, your hormonal and nervous systems could bounce back quickly after ejaculation. A few hours of rest, and your energy return. But with age, this process slows down dramatically. Each orgasm depletes a bit of your nervous system's fuel. It lowers dopamine and serotonin temporarily. It shifts your autonomic balance toward the parasympathetic side. And most importantly, it dips testosterone, even if just for a little while. For younger men, this isn't a problem. But for older men with already declining levels, it can tip the scale. Many men report feeling groggy, foggy, or flat the next day, not realizing it's tied to frequency, not age. 2. Energy is a finite resource after 60. As we age, every drop of energy counts more. Recovery after workouts takes longer. Deep sleep becomes lighter, and the body needs to protect its reserves. When you masturbate too often, especially out of boredom, stress, or habit, you're not just passing time. You're spending valuable physical and emotional energy, and the cost adds up silently. One patient told me, "I used to think it was helping me relax, but now I wake up drained, like the joy has been taken from me." That's not just in his head. It's physiological. Your system is signaling, slow down. 3. Too much, too often can affect sleep, mood, and motivation. Frequent ejaculation without recovery can alter your sleep architecture. It may reduce REM cycles, increase nighttime awakenings, and create hormonal imbalances that leave you restless at night and unfocused during the day. It can also affect your mood. When you deplete dopamine regularly, your brain becomes less responsive. You might feel unmotivated, emotionally flat, or even mildly depressed without ever connecting the dots. This is especially true for men who use masturbation to escape stress. Instead of calming the nervous system, it overstimulates it briefly, only to crash harder afterward. So what's the solution? Find your rhythm, not someone else's, not a number from a blog or a study. Yours. For many of my patients, reducing frequency to 1 to 2 times per week creates remarkable improvements in energy, sleep, and even emotional well-being. Others find power in exploring non-ejaculatory pleasure like tantric touch or erotic massage, which stimulate the senses without draining the body. The goal isn't abstinence, it's alignment. Ask yourself, am I doing this because my body is asking for it or because I'm avoiding something else? That question alone can change everything. You have the power to reclaim your energy not by doing more, but by doing less with more care. And remember, you don't have to eliminate pleasure to protect your vitality. You just have to respect the system your body is working with now. Coming up next is perhaps the most overlooked mistake of all, one that doesn't just affect your energy or arousal, but your long-term urinary health, comfort, and prostate function. Mistake. Number 4. Ignoring prostate health during self-pleasure, the silent toll you never expected. He was 68, fit, active, still hiking local trails and helping his grandkids with school projects. By all appearances, he was aging well, but something was bothering him. It's nothing sharp, he said. Just a pressure, a heaviness, and this nagging feeling like I'm never fully relieved. No fever, no infection, no red flags. But when I asked about his solo habits, how he masturbated, how often, and what posture he used, he paused. I've done it the same way my whole life, he replied. And that, right there, was the issue. As men age, the prostate becomes more vulnerable, not because it's suddenly weak, but because the surrounding tissues change, blood flow diminishes, and inflammation becomes harder to resolve. Yet most men never consider how the way they touch themselves affects this tiny but powerful gland. Let's break it down. 1. The prostate is under pressure. Literally, you masturbate in a seated, slouched position, say, on the edge of a chair, or hunched over in bed. You place direct pressure on the perineum, the area between the anus and the scrotum. This area sits directly below the prostate. Add to that any habit of pressing or tensing the pelvic floor during climax, and you create an environment where the prostate becomes compressed, irritated, and inflamed. You may not feel it right away, but over time, that dull pressure becomes a regular visitor. Some men describe it as fullness. Others say they feel like they never completely empty. Still others report a slight burning sensation or pelvic heaviness that won't go away. And most of them have no idea it's connected to how they masturbate. 2. Post-ejaculatory neglect, missing one crucial step. Another common oversight. Not urinating after climax. It may seem trivial, but post-ejaculatory urination helps flush residual semen and bacteria from the urethra, which runs through the prostate. When you skip this step, especially repeatedly, it increases the risk of lingering inflammation, discomfort, and even prostatitis, chronic prostate irritation, or infection. It's a simple step, but an essential one. 3. The long-term consequences. More than just discomfort. Unchecked, these habits can snowball into real-life functional problems. Urinary urgency, wake or hesitant urine stream, more frequent nighttime trips to the bathroom, constant feeling of pressure in the groin, reduced sexual pleasure, and sensitivity. These symptoms often sneak up on men. At first, they blame age, then diet, then stress. But the root cause can often be traced back to years of unconscious pressure and neglect of the prostate during solo activity. And the worst part, no one told them. Not their doctor, not their friends, and certainly not the media. But here's the truth. You have more control than you think. 4. Protecting your prostate. Small changes, big relief. The fix isn't complicated or invasive. It's subtle, gentle, respectful. Change your posture. Lie down or recline comfortably rather than sitting upright with pelvic compression. Avoid deep perineal pressure. Use touch that stimulates pleasure without pressing on the sensitive area beneath the scrotum. Always urinate after climax. This simple flush helps prevent buildup that can lead to inflammation. Tune into frequency and sensation. If something feels off, don't ignore it. Adjust. Listen. Care. You don't need to give up pleasure. You just need to choose it wisely. Remember, the prostate isn't just a gland, it's a gatekeeper for urinary health, sexual comfort, and long-term well-being. Treating it with care means honoring your whole system. I've seen men in their 70s reclaim energy, sleep, and even emotional calm just by learning to touch themselves differently. Not harder, not faster, but smarter. Now that we've walked through the 4 most silent but harmful masturbation mistakes men make after 60, let's step into the most important part of this conversation: what you can do next, and why small shifts in how you care for your body can lead to a completely different experience of vitality and confidence in this chapter of life. Conclusion: it's not too late, your body is still speaking. Will you listen now? If you've made it this far, let me say something you may not hear often enough, especially as an older man navigating the changes in your body. You are not broken. You are not behind. You are not alone. the slower response, the duller sensation, the quiet discomfort that creeps in without warning. These are not signs that you've failed. They're signals. Signals from a body that has carried you through decades of work, stress, joy, loss, and life. And now, it's asking you for a new kind of relationship. For years, maybe decades, you've been told to push harder, fix faster, power through. But after 60, that mindset no longer serves you. In fact, it may be silently harming you. You've now seen the 4 most common masturbation mistakes older men make: forcing release without respecting erection quality, which leads to subtle injuries and diminishing sensitivity; relying on pornography, which rewires your brain away from connection and toward numbing; overstimulation, masturbating too frequently, which slowly drains your nervous system, affects your energy, and clouds your mood; ignoring prostate health, which can quietly disrupt your urinary comfort, sexual satisfaction, and long-term well-being. These aren't dramatic problems. They don't announce themselves with sirens or pain. Instead, they erode your confidence and connection in silence until one day, you no longer recognize the man you once were. But the good news is, you can return to him. You can rebuild strength not by force, but by listening. You can reignite pleasure not through urgency, but through presence. And you can reclaim your vitality not by doing more, but by doing differently. So, what do you do next? Start small. Change your posture during self-pleasure. Skip the screen, and try memory or imagination. Give yourself longer rest between sessions. Drink water. Breathe deeper. Listen closer. Ask yourself one gentle question each day. What does my body truly need today? Not, how fast can I finish? Not, why isn't it like before? But, how can I honor the man I've become now? This is not just about sex. It's about quality of life. About rediscovering a relationship with your body that is rooted in care, not performance, in wisdom, not willpower. And that journey doesn't end with this article. If this message resonated with you, if something clicked, if a light came on in your heart, I invite you to stay connected. Subscribe to the channel, turn on the bell, and be part of a growing community of older men who are reclaiming their health, their joy, and their quiet power. Because this isn't just about avoiding mistakes. It's about choosing something better for your body, your mind, and your future. You still matter. Your pleasure still matters. And you are still deeply, fully, powerfully alive. Thank you for trusting me with this conversation. I'll be here for the next one. Warmly, Dr. James Rowen, urologist, men's health advocate, lifelong learner.